We are seeing greater numbers of patients into our COVID ward and into our COVID CCU than we have done since March. So of course that, number one, creates a lot of strain in terms of the intensity of the nursing staff and the medical staff and the care that people are receiving. But it also creates an intensity in terms of how we manage increased volume. So for example, we have our CCU, or intensive care unit, which up until the last week or so was able to look after both COVID and non-COVID patients. But we are now reaching a point where the numbers are such that the isolation facility of that particular unit is being overwhelmed. And so now we've had to move back to something which I'm sure we're very familiar with, which was the day surgical unit, which has now become the clean CCU. Patients who we're putting in there are patients who need intensive care and high dependency level care, and also patients who've had cancer surgeries and urgent surgeries. And that's some lesson that we learned very clearly from the last time we went into major incident, is that there are certain things that we just cannot stop. So we're absolutely dedicated to delivering those kind of services as well. So you have patients who've had very significant surgery in there as well, but they're in the clean side. Then of course we've got our COVID ward, Victoria ward, which has now reached close to capacity, 22. We were at 24 only 24 hours ago, which is pretty close to capacity, and we are looking now at almost to the point of overspill. So we might have to use John ward next to have that COVID ward number 2. And then on top of that, of course, we have to protect these areas. So if we're keeping one area COVID positive and one area clean, we cannot afford for those two to intermix, basically. So that we're dedicating an acute admissions ward, which will be a rainbow ward temporarily, which everybody knows is the children's ward. And we'll use that as an area so that until we determine whether somebody is positive or negative, and then determine where in the hospital they go to, that gives us a level of safety.
We continue to see a large amount of people getting tested, not today, but yesterday we saw approximately 2,000 queuing up and getting swabbed at the Midtown drive-through. How much pressure is there, and has there been, on the testers and the lab?
You know, the testers in the drive-through and all the swabbing facilities, and of course in the laboratories, both the hospital laboratory and the public health laboratory, are enormous. To put this in context, the public health laboratory, when we scaled it up, when we started this, said that they could manage 600 swabs a day, and that in itself was a bit of a revelation. I think in the last 24 or 48 hours there was one period where they did 1,700. So this is a massive testament to the team up there, who are absolutely working their socks off, and it's incredible that they're managing to do those kind of volumes. Now, why are we seeing such a demand on those? Well, of course, this is the time of year when more people come into hospital, more people get sick, and of course, as we all know, the symptoms of COVID are also the symptoms of flu, or the symptoms of the common cold, and just the snuffles and those kind of things which we see at this time of year when it's cold. And I think also, regrettably, we've lost a number of members of our community because of COVID, and I think that's worried people. So I think people are becoming a bit more vigilant now about getting themselves tested and swabbed.
We've seen today 48 cases in elderly residential services. Given the way that the pandemic has developed in care homes in places like Spain and in the UK, that is a matter of concern.
Absolutely. What's very interesting about the outbreaks, the outbreak that's happened in the elderly residential services, is that all the facilities within the health authority, ERS, have been the tightest, the strictest. Daily swabbing of their staff, daily swabbing of the residents, shut down very early when it comes to visitors. They are masters at this, and even so, despite that, this virus is so tricky that it still has spread despite very, 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 very good measures. And of course, you're absolutely right. We've got now 48 people within the elderly residential services in the oldest and therefore the highest risk age groups. Now, they do have, excellent levels of care. There's no question about that. They have not only excellent nursing care and residential care, but we have created almost like a medicalisation of the unit up in elderly residential services, which creates a much more responsive, higher level than perhaps you would see in an elderly residential unit in the UK or in most other European countries. So we're much more responsive, the care is better. I think we'll see better outcomes, but of course you're absolutely right. It is a worry, and we just have to take it day by day.
Finally, Dr. Rawal, a message for the public, anyone watching or listening to this interview who wants to try and help to minimize the overstretching of the GHA, what can he or she do?
So this is a very difficult one for us, because this is a time of year when lots of people get coughs and colds and flu, and lots of people feel unwell, and all of those chronic conditions that are non-COVID, that they've not gone away, often get worse during the winter. Arthritis gets worse, lung conditions get worse, breathing conditions get worse. So I'm very aware that people are needing medical help. All I'm asking is, please just be a little bit mindful before you pick up the phone, before you seek an appointment, because the health services at the moment are doing their absolute to deal with the huge numbers of cases of being reported, or concerns of people with COVID, and the drive-through and the swabbing and everything that goes with it. So I would just ask that if you're feeling a little bit under the weather, maybe just try taking some Panadol and just get an early night first, and just have a think before you go ahead. Try and keep away from the health services as best you can, simply because the hospital and all health services, because lots of people gather in these places, are a higher risk of catching COVID. And maybe the tricky ask is here, what we're saying is, perhaps just be aware for us that we are really, really, really busy, and we're doing our utmost to look after absolutely everybody for everything. But on the other hand, help us a little bit, but we are here for you. Please don't avoid seeking medical help if you need it.